Hello, everyone, and welcome. Thank you for joining me in another live stream event. I hope everybody is doing well. Feel free to get comfortable, grab a pen and notepad for today's presentation. My name is Melissa Favela, and I'm the community educator for Southern Caregiver Resource Center, where we care for those who care for others. And today's presentation is Navigating the Journey, Insights into ALS and Caregiving. So let's get started. Today's learning objectives are the following: learn about ALS and its progression, evaluate ways to prepare as an ALS caregiver, and explore the challenges caregivers face when caring for someone with ALS. So why are we talking about ALS? Here are some statistics to help us get more of an understanding of why it is important that we talk about it, among other things. In 2018, approximately 30,000 people living with ALS in the nation were reported. Approximately 300 people live in San Diego with ALS. And annually, there is an approximation of 5,600 people that are newly diagnosed with ALS in the nation. And also, it is important to know that ALS is 20% more common in men than women. However, with increasing age, the incidence of ALS is more equal between men and women. And 20% of people with ALS live 5 years 10% survive. 20% of people with ALS live 5 years, 10% survive closer to 10 years, and 5% live 20 years or longer. So again, some statistics to establish why we should be talking about ALS. Next slide, please. So let's move on to what is ALS. ALS is commonly known as Lou Gehrig's disease, and it is a progressive neurodegenerative disease. What happens with ALS is the degeneration of motor nerve cells in the brain and spinal cord. When the motor neurons can no longer send impulses to the muscles begin to waste away. Therefore, they atrophy, causing muscle weakness and twitching. Eventually, the ability of the brain to start and control voluntary movement is lost. This causes the loss of strength and mobility of arms, legs, and body. The muscles of the diaphragm and chest fail, and individuals lose the ability to breathe without ventilatory support. Now, it is important to note that the disease does not affect a person's ability to move their eyes or to see, smell, taste, hear, or recognize touch. And it does not usually impair a person's thinking or other cognitive abilities. However, several recent studies suggest that a small percentage of patients may experience problems with memory or decision making, and there is growing evidence that some may even develop a form of dementia. Now, ALS is sometimes referred as a syndrome because the disease becomes apparent in various patterns. ALS also rarely occurs as an inherited disease. Next slide, please. So now that we know a little bit more about the generalized definition of ALS, let's talk a bit more about the symptoms associated with ALS. There is a gradual onset of symptoms. So when we say gradual, is that they may start appearing here and there, and the rate of the progression of these symptoms is variable. So there really is no specific timeline as to the onset of these symptoms. Universally experienced symptoms are progressive, muscle weakness, and paralysis. Symptoms can begin in the muscles that control speech and swallowing, or maybe in the extremities, like in our hands, arms, legs, or feet. But not all people with ALS experience the same symptoms or the same sequences or patterns of progression. That is something very important to know and recognize. Since ALS attacks only motor neurons, the senses of sight, touch, hearing, taste, and smell aren't affected, as we mentioned in the past slide. This means that for many people, Muscles of the eyes and bladder are generally not affected. Now let's talk a bit more about the diagnosis of ALS. There is no one test or procedure to ultimately establish the diagnosis of ALS. Clinical examination and a thorough series of diagnostics tests are necessary to rule out other diseases. So this takes time. The ruling out of other diseases and tests and procedures may include diagnostic tests, blood and urine studies, a spinal tap, X-rays, including an MRI, myelogram of the cervical spine, muscle and or nerve biopsy, and a thorough neurological examination. Now, it is important to know that even though all of these tests may be possible and they may be part of ruling out other diseases and identifying ALS, it is important to recognize that these tests are done at the discretion of the physician. This is usually based on the results of other diagnostic tests and the physical examination. Several diseases have some or even the same symptoms as ALS, and most of those conditions are treatable. Now, the ALS Association recommends that a person diagnosed with ALS seek a second opinion specifically from an ALS expert. So that means that it's a doctor, someone who diagnoses and treats many ALS patients and has training in this medical specialty. So again, this is a recommendation from the ALS Association. Now, the diagnosis requires a lot of testing, including the tests that are listed here, but it is important to know that it may include other types of tests that are not listed here as well. Additionally, they may include history of the patient, right? So changes that they might notice. So again, all of these are at the discretion of the physician. Now, let's talk a little bit more about the actual progression of symptoms. Now that we know what ALS is, we know how the symptoms start appearing, the diagnosis of ALS. So now let's focus on how the progression looks like. Early symptoms include muscle weakness or stiffness. The progression of weakness, wasting, and paralysis of the muscles of the limbs, trunk, and those that control vital functions generally follows. And there is a difference in how fast and in what order symptoms and progression occur. And again, with ALS, it's important to note that progression isn't always a straight line in a single individual. So from individual to individual with ALS, it'll be very different and it's not a straight line. It's common to have periods lasting weeks and even months with very little or no loss of function. So that is something that is particular to ALS. According to the ALS Association, cognitive impairment and dementia are not present in all cases of ALS. However, it is recognized that approximately 50% of people with ALS demonstrate mild to moderate cognitive and or behavioral impairment, and up to 20% of people with ALS have dementia. When dementia or cognitive impairment is present in people with ALS, it resembles symptoms of frontotemporal dementia or FTD. This is expressed in the progressive worsening of behavior, personality, and or language. Now, there is a push to continue this ongoing research of ALS and its relationship to dementia or cognitive impairment. In that way, we would have a better understanding of this relationship. Hopefully, there will be more information available to the person with ALS and the families that are caring for them, right? Their support system. This will allow for better understanding, treatment management, and behavior understanding for those individuals and caregivers. Now, when we talk about a person living with ALS or a person with ALS, um, you know, living for them is making sure that they can continue with their usual daily activities and stopping before becoming fatigued. This is a recommendation that people with ALS will receive a lot. So making sure that they understand their limits, and once they know what their limit is, that the activities that they have to do stop before reaching the limit. They are also it's also recommended for them to plan on being strategic, right? Plan on how to use your energy and strength and focus on setting your own limits of exertion. What is a limit for someone living with ALS may not be the same limit for another person with ALS. So it is important that the people who are living with ALS focus on their specific needs and their specific limits. Now, physicians can suggest exercises to help strengthen unaffected or less affected muscles to aid in maintaining mobility of those said muscles. So this, again, will be very specific from individual to individual. And the treatment aimed at relieving symptoms can be very effective. Now, the following are areas in which to focus on that can enhance the quality of life of the person living with ALS. Mobility. Mobility is one of those areas. Changes in mobility are expected to occur with ALS because we know that it affects the muscles of the body. Therefore, working with a physician and occupational therapist can help identify appropriate devices to help maximize independence and reduce caregiver strain as changes in mobility occur. The range of motion and, of course, stretching exercises can help people living with ALS maintain flexibility, making movement on a regular basis a little bit easier for them. However, it is important to understand that movement just to move or exercises just to exercises, they're not all helpful. We do need to consult with a professional to understand which exercises are helpful for that person living with ALS. Braces, canes, and walkers can all help maintain independent mobility for as long as possible. Now, as the disease progresses, wheelchairs, lifts, and other special equipment can enable people with ALS and their caregivers to work as a team to help the person with ALS stay connected to the world around them and to ensure appropriate care. These mobility devices can also prevent the caregiver from taking on increased physical load that maybe their body is not able to handle, therefore preventing injury for the caregiver. And of course, safety for the person living with ALS. Another of the aspects that can help with people living with ALS is communication. Now, a speech therapist can really help maintain the speaking ability for as long as possible. So again, another professional in their own area. However, the loss of speech does not mean the loss of the ability to communicate. There are assistive communication devices, from simple boards to sophisticated electronic devices, including computer applications. All of these permit communication even into the latest stages of ALS. Now, luckily, we have seen rapid advances in technology, and they have resulted in products that dramatically increase the independence of people with very little mobility, allowing them to speak, uh, operate lights and other controls, and remain contributing members of their families and communities. So these devices can prevent people with ALS from becoming isolated. They can continue being vital parts of their community. Now, people with ALS now also have the option of a voice bank. So maybe you've heard of this, maybe you haven't, but just to give you a brief understanding of what a voice bank is, it is a way for people who live with ALS to create a personalized, synthesized version of their natural speaking voice. And this is used in a speech generating device. So when people with ALS are communicating with others, their previously recorded voice is installed on their speech generating device. And so in itself, this can be very positive when it comes to family and caregivers being able to hear the pre-recorded voice of the person living with ALS when they are no longer able to speak. So it brings another level of comfort and a dynamic that feels more in tune with what the relationship has been pre-ALS. Next slide, thank you. Now, there are some issues that come with ALS, as we have seen, mobility, etc. But something that I want to highlight here is that we can also see breathing difficulties. As muscles weaken, breathing becomes more difficult and less effective. Now, the symptoms of these breathing difficulties may include labored breathing, even when there is no movement or no exertion, so without activity, fatigue, because that means that the body is not receiving enough oxygen, issues with sleeping, because if we are having breathing difficulties, we may not be sleeping, our 8 hours or 10 hours or whatever the amount of hours is. People may be waking up throughout the night. And also another sign would be waking up with a headache. That means, again, that there wasn't proper oxygen intake throughout the night, and so there is a slight headache. So what can help with these breathing difficulties? These are just some recommendations, but of course, you are always encouraged to speak to your doctor or even an occupational therapist to see what can help for your specific case. Now, some of these general recommendations include positioning while sleeping, so making sure that the position is good to help increase the amount of oxygen that we intake, so allowing for easier breathing throughout the night, making sure that we're conserving energy during the day. And this ties back to the recommendations of making sure that we know the limits, making sure that people with ALS are stopping their activities before they hit their limit, making sure that they are doing breathing exercises that can maintain the functionality of the muscles that are involved in breathing. And another thing could be non-invasive ventilation options, which are many. And the last option could be invasive ventilation options. So again, highly encourage you to ask these questions to your doctor if you are a person living with ALS or you're a caregiver of someone with ALS. Now, when we're talking about the ventilators, they can't do the person's breathing for them. This option can prolong the life of a person with ALS, but it is important to consider that it also increases the need for care and also the cost of care. So these are things to consider. Now, the willingness and availability of caregivers can impact this decision. Deciding whether or not to use these various types of assistive breathing devices will be one of the hardest decisions people with ALS and their caregivers need to make. Preferences regarding breathing support should be discussed with the physician and included in the advanced directives, which we will be talking about in upcoming slides. Something else to consider is nutrition. For those living with ALS, proper nutrition and hydration are critical in sustaining weight to prolong and maintain the quality of life. Now, the goal in maintaining adequate nutrition is to consume enough calories to meet the individual's daily energy needs And for those diagnosed with ALS, choosing the right foods with the appropriate consistencies while employing tips for safer swallowing can really help maintain nutrition and mealtime enjoyment. Adequate nutrition and hydration are essential for maintaining muscle strength, as weight loss leads to faster muscle wasting. Now, studies show that people living with ALS do better when they maintain their weight, and that is compared to those who lose weight. And those who maintain adequate hydration may also have a longer life expectancy. Now, as problems with swallowing develop, food can be processed to make it easier to swallow. A registered dietitian will be essential to help develop strategies to ensure that the person is receiving enough nutrients, calories, and of course, fluids. If the person is not getting enough food, or if choking and food inhalation become a problem, they may want to consider a feeding tube. Now, a feeding tube can help people meet nutrition and hydration needs as ALS progresses, and or their metabolic needs are changing. Now, tube feeding, just to give you a little bit more information on it, can be referred to as PEG, so PEG, and it is surgically inserted into the person's stomach. Food goes through the tube and enters the stomach directly. This can be another very difficult decision for people with ALS and their families and their caregivers. Preferences regarding the placement of a PEG should be discussed before the need arises and included in the advance directive as well. And of course, as with all treatment decisions, they should be reviewed periodically. Gathering the appropriate resources to meet the challenges of ALS can be significantly difficult for many families. Both the ALS Association and the Muscular Dystrophy Association have programs through which people with ALS can borrow assistive devices and equipment that they might not be otherwise able to afford. So I mentioned this to make sure that you know that there are resources out there available for you other than Southern Caregiver Resource Center. Something else to consider is, and one of the biggest things to consider is the mobility challenge with ALS. Environmental modifications can help you stay safe and really maintain that independence for as long as possible. And they can also lower the caregiver's risk for injury by making tasks as assisting the person with ALS, like transferring and repositioning, a little bit less physically taxing. So we have to identify the needs, right? What are the needs of the person with ALS? What are the needs of the caregiver as well? Now, this can be challenging if we are not sure what we are looking for. Therefore, we should be working ideally with an occupational therapist because they will know what to recommend or what to look for so that the caregiver and the person with ALS can identify the needs. Now, working with an occupational therapist can really determine these things that are needed. And of course, it can also help to plan ahead. That way, hopefully, it can help us offset that financial strain by figuring out a home adaptation budget. So the sooner we know what are some of the recommendations or adaptations that we need to do, the sooner we can get working on a budget. And that way, it's not an urgent expense necessarily, right? And so that can really help by working with the occupational therapist. Now, there are also other considerations, right? So for example, what is the accessibility outside of the home? What is the mobility inside the home? What is the safety around the shower and toilet access? These are some common areas that require home adaptations. And of course, this is important because people with ALS will need to, go inside the home, go outside the home, and within the home, they'll need that space to be mobile and have access to different areas of the home, ideally. And of course, the safety and access for the shower, the toilet, that is very important because we want to avoid the risk for injury. So those areas will be kind of a focus, if you will. And of course, we mentioned budget, right? Budget is one of the things that can really put a pause on the necessary modifications or can even stop them from happening. So, some of the, it is important to recognize that some of these modifications are not included in a regular budget. They may be out of our budget, but it is again important to know that there are resources out there for these types of modifications. You can contact local organizations and ask them if they can help with some home modifications at no cost or maybe a lower cost than if you would just do them on your own. So again, making sure that first we are informed, we identify needs, we consider the specific needs of the person with ALS and our needs as caregivers, and then build a budget around those modifications needed. Now, let's pivot a little bit. I did mention we were going to talk about the Advanced Healthcare Directive, and this is the point where we get to talk about it. Planning for the future can be very daunting and it can be a very intimidating task. However, the earlier these conversations are had, the earlier the planning can happen, and the more peace of mind the care receiver and the caregiver will have in the future or as ALS progresses. Now, care planning can be a good starting point to discuss the caregiving that will happen, who will be part of the support team, who will gather and understand the information about the progression of ALS at the very least. Now, having advanced healthcare directives, or as it's also commonly known, a living will, along with the POLTS, which stands for Physician's Order for Life-Sustaining Treatment, and of course the power of attorney. All of these documents can really help the family have that peace of mind when the time comes to make difficult healthcare decisions. And of course, financial planning, right? We just talked about budget regarding home modifications, but financial planning is something bigger. And it is equally important since medical treatment and additional care can cause financial strain on multiple levels. It is important to be financially prepared as much as possible to determine how needs will be paid for. So again, not necessarily a complete list of what we should have ahead of time, but these are the basics as to what we should have ahead of time. So if you are a person living with ALS, if you are a caregiver for someone with ALS, let's have these conversations and let's start talking about these documents if they aren't already in place. Now, let's talk about palliative care and hospice. These can help the person pass away with dignity and maximum possible comfort. And of course, they are family centered. Hospice is a type of palliative care that can help a person during the last 6 months of their life without the goal of prolonging their life or curing their condition. Now, palliative care can happen at any time over the course of a disease, and it may or may not include efforts to try to cure the person or prolong life. Now, palliative and hospice care involve a team of people working together to meet a person's needs. The team often includes family members, the person's primary physician, nurses, home health aides, social workers, therapists, trained volunteers, clergy, and or other counselors. So this is, as you can see, a list of professionals and of people that may be involved, and may have more or less people involved. And of course, the services can include pain and symptom management, therapy, respite, emotional and spiritual counseling. That's why we have a team working together in these places. So again, if hospice and or palliative care is something new to you, I would encourage you to look more into it, it's a very good tool to have and to know about, and also know about the services that they offer, as they can be very helpful for the person with ALS and for the caregivers as well. Now, let's talk about when we are the caregivers for someone who has ALS. Of course, the diagnosis of ALS for someone impacts everyone in the family, or everyone who is considered family. Thankfully, again, there are many resources that are there to help not just the person who was diagnosed, but also the family to understand, to cope, and learn how to live with someone who has ALS. Now, additionally, caregivers who are in charge of the care receiver, or the person living with ALS, they will also need their own support system, and they will need help with the caregiving responsibilities, as well as to have time for themselves. So it's not just about the care for someone else, but also the care for the caregiver, as we say here at SCRC. Now, the experiences of each ALS caregiver will be different, and this is because of the nature of the disease as well as the progression of the disease. We know that the progression is not linear. We know that everybody's symptoms progress differently and show up differently. And so, again, the experience of the caregivers will also be different. Now, let's talk about respite. And again, if this is something new to you, I would encourage you to find out a little bit more and see if it would be helpful for you to have respite. Now, here at SCRC, we often say the best way to be an effective caregiver is to take care of yourself. If a caregiver is fixated on caring for the care receiver and starts neglecting their own needs and health, that can lead to adverse health issues that affect not just the caregiver, not just the caregiver's health, but also the care receiver ultimately as well. Respite provides family caregivers with an opportunity to take a much needed break from the daily care they provide. Taking a break looks different for everyone. Some people may decide to do an activity, while others decide to sleep and rest, and that's okay. We do want to highlight that it's important to take a break before we feel constantly stressed and burnt out. So similar to the recommendations of a person with ALS, whereas know your limit and stop before your limit, same thing for caregivers. Make sure that you know your limit, but that you also stop before your limit, right? So that you are not constantly stressed, and that stress that is constant doesn't lead to burnout, among other things. Now, I want to highlight here, and again, letting you know that there are resources out there available for people with ALS, for caregivers who are caring for someone with ALS. Within a CRC, we have resources that are helpful to you as a caregiver to inform, right? To have more knowledge. And as we have more knowledge, hopefully the caregiving becomes a little bit more manageable. So we do have some videos available on our Facebook page or on our YouTube page. They're listed here. You can see the titles. We have Caring for the Caregiver, Mobility Assistance and Tools, to hopefully give you some idea of what are some of the mobility issues, or learn a little bit more about what's included in mobility when it comes to caregiving. Additionally, we have the year-end estate and financial planning workshop. This is a video that we did, and hopefully this will give you more tools as to those difficult, maybe challenging financial decisions that caregivers often have to do, and hopefully this will help you plan ahead of time. We also have a very helpful video talking about managing caregiver stress, because we know that caregiving is stressful. Now, the important thing is to learn how to manage that stress. And we also have another video that talks about healthcare documents. So it really goes more into detail regarding the Advanced Healthcare Directive, POLDs, etc. So if these are new topics for you, if these are terms that you haven't heard before, feel free to log into our website and look at the videos that we have available. We also have a podcast episode, which is our podcast that's called Let's Talk Caregiving. It's episode 71, and it's titled Caring for Someone with ALS. So if you listen to podcasts, or if you're in a hurry and you don't have time to watch a video, but maybe you do have time to listen to a podcast, I would encourage you to listen to episode 71. And additionally, if you want some reading material, if you want to print out a page and look at a page, or if you just want to look at information in your computer, in your device, we do have fact sheets. We have an ALS fact sheet, and we also have fact sheets that go into Advanced Healthcare Directive and POLS. So again, these documents can be a little challenging maybe to understand initially, so you can always have a fact sheet about them, so you can always go back and reference. So again, SCRC has many, many resources available for you as a caregiver. And of course, these are our core services, our additional services that Southern Caregiver Resource Center offers to family caregivers. We have our family consultants, which are master level clinicians. We also have our support groups, which are available in person or virtual in English and Spanish. We also offer individual counseling sessions for when we really don't feel like sharing in a group setting. We really want that one-on-one with a counselor. We have those available in person or virtual, in English or Spanish. We also have legal and financial consultation. We have, as I mentioned in the last slide, a large amount of educational materials that are available at your fingertips at whenever you have time, right? Maybe you have 10 minutes at the end of the day. You can have that information whenever you have the time. We also have our TLC and Calma classes, which I'll talk about in the upcoming slide. We have employer resources, specialized information, and of course, as I mentioned, respite. We offer temporary and needs-based respite. And of course, a lot of online resources and services through our website. Now, here is our Caregiver TLC class. These are evidence-based classes that are free, and they're offered to family caregivers who are caring for someone who has memory loss, Alzheimer's, or another form of dementia. And this program helps the caregiver, yes, understand challenging behaviors and how to, work through them, but it also focuses on the caregiver's well-being. So how to manage stress, how to learn coping strategies, how to build their own support system to hopefully avoid constant stress, burnout, isolation, etc. So this may be something that would be useful for you as a caregiver. And of course, going back to our online resources, we have a tab on our website, which is www.caregivercenter.org. And this tab is called iCare Portal. This iCare Portal houses all of our online educational material. So I would encourage you to browse this section. We have our Caregiver Corner section, which are, quick tip videos. They're 1 to 2 minutes long. So if you don't have an hour to watch a full video, maybe you have a couple of minutes to watch quick tip videos. As I mentioned, our podcast, we have family caregiver classes similar to this one on many, many topics. And if you want to stay updated on events that we are hosting or attending, or information regarding ALS or other conditions, you can sign up to our newsletter, Wavelengths, and that way you can receive updates as to what is going on with SCRC and what services may be available to you as a family caregiver. And if you are active on social media, I would encourage you to follow us on our social network. We're active in Facebook, Instagram, LinkedIn. We have a lot of videos on YouTube and, of course, our podcast. If you are active in Facebook and Instagram and LinkedIn, we are constantly putting out information and resources for family caregivers. So this is also an easy way. If you are scrolling through your social media, you can have this information available to you. And of course, you can also contact us through social media. Now, if you have questions about the services that Southern Caregiver Resource Center offers, if you're interested in talking to someone, if you have questions, please feel free to reach out to us. You can give us a call toll free at 800-827-1008 or 858-268-4432. You can give us a call Monday through Friday, 8 to 5. If you give us a call outside of these hours or maybe during a holiday, feel free to leave a voice message and we will get back to you within the next 48 working hours. Or again, if you want to look at all of our online resources, feel free to log into www.caregivercenter.org and browse our website, go through the iCare portal, and then that way you can see what other information is useful for you. Now, I want to thank you all very much for spending this time with me. I hope you learned something new, you got new information, and we'll see you on our next live stream.